The World Heart Awards recognize and applaud the exceptional efforts, the innovation, the dedication demonstrated by individuals, institutions, and initiatives. 4 outstanding heart health champions committed to the goal of heart health for all are joining us to share their stories and insights. Arianne, over to you to moderate this very inspiring session, I'm sure.
Thank you so much. Now, before I begin, I know that by now you must all be very tired and that by the end of the summit, your brains are going to be a little fried. So I also know that you will also be enjoying this amazing dinner. But please know that at 10 p.m. tonight in front of the lake, you can also enjoy the largest drone spectacle in Europe. So if you're here visiting, do not miss that. After dinner, you know what to do. There will be a bunch of concerts, food trucks, everything. So you know what they say, a happy mind, it's also a happy heart. Now, the moment of truth here. Moving the needle. For those of you who are not familiar with that expression, it means making a noticeable difference. Well, I think there is no better expression to describe what the following group of doctors, scientists, and advocates are doing at a global level. They have all found ways to move the needle in the direction of equitable and more efficient care when it comes to heart health. That's why we created the World Heart Awards, to honor those who go above and beyond their mission to fight cardiovascular disease. As was mentioned before, this session will highlight the outstanding contributions from 4 award recipients who have demonstrated their commitment at a global level. Without further ado, please allow me to introduce Jean Bukhman, Director of the Center for Integration Science at Brigham and Women's Hospital in Boston. Anna Mocumbi, Head of NCD Research Division at the National... I think you have my seat. It's okay. Anna Mocumbi, Head of the NCD Research Division at the National Health Institute in Mozambique. Voss, Business and Operations Director and Corporate Secretary and Treasurer at Mended Hearts. Gabriela Lima, de Melo Ghisi, Scientist at the Kite Research Institute in Toronto, Rehab. Welcome. Now, Gabriela, since you were the last I introduced, why don't we start with you?
Sure.
Now, to make it short, Gabriela is here because she contributed at reinventing cardiac rehab during the pandemic. Gabriela is a Brazilian scientist based in Canada, focusing on cardiac rehab. As a reminder, cardiac rehab is a supervised space where people attend weekly to exercise, to receive counseling, and education about a healthy living. This has proven to reduce morbidity and mortality by 25%. Now, of course, when COVID came and people could not attend on-site anymore, you were really curious about how that would affect the morbidity and hence the mortality of all of the patients. So you created this massive survey. I want you to tell me all about that.
Sure, yeah, thank you so much for having me. So let's just step back a little bit. So I'm part of the ICCPR, which is a World Heart Federation member. So ICCPR stands for International Council of Cardiovascular Prevention and Rehabilitation. So we are a group of 43 cardiac rehab societies around the globe, plus 17 members from countries that do not have a cardiac rehab society. So when the pandemic started, let's say, I don't want to use the word the common cardiac rehab, which was an on-site group session, of course, was not possible. So due to all the restrictions, the government restrictions, the programs, basically they stopped delivering cardiac rehab, they stopped the delivery of services, And we started receiving lots of emails from our members, like, do you have any resources, what we can do to continue to support our patients? It was hard for me personally to see all those emails coming, and really like understanding the needs, because each program globally, or each country globally, was in one stage of the pandemic, right? So we then decided to do this global survey. It was like this quick thing of like two weeks putting everything together. And we received more than 1,000 responses from 1,000 programs around the globe to really understand what their needs were, what was happening with their programs, how they were delivering the core components of cardiac rehab, and really which resources they were using. So then we could share resources with the other programs. We could work together to really support the continuity of cardiac rehab delivery.
So you basically also created webinars to connect during the pandemic and exchange the best practices to create a guide, right?
Yeah.
To how to proceed. You implemented that and put it on a website. Was that it?
Yeah. So ICCPR has a website, globalcardiacrehab.com. So basically, what we did was that we listened to cardiac rehab programs with the results from the data, all the resources we put together on the website. And it's funny, the day that we launched, we had 2,000 views. It was like, it's a peak when you see it was something that really people needed, and we are still updating those resources to this date. We had webinars to support also programs, lots of emails saying thankful, and most importantly, lots of programs continuing the care of the patients, right? So that was our goal, really, to provide the resources, to listen, to make those connections from programs that were closed with the programs that were still operating, and really make those connections to continue to support patients.
Now, very briefly, what was the hardest part of that project?
I think it's so our work in ICCPR, it's a volunteer work. So really like trying to connect and listen from everyone and put everyone, like really making sure that we were addressing the needs of all programs. And it's great when I see like the panels with different people here. I hear the stories, like it's so different, the reality in all those countries. So really trying to reach and address the needs from specific groups, specific scenarios.
Right. Now, why don't we go now here with the people closest to me, with Jean and Anna. You've both been working in the same or under the same project, correct? You've worked at reducing the burden of cardiovascular disease in populations living under extreme poverty. So we're talking about 1 billion people who rarely have access to hospitals, to proper care, and of course, to the right equipment. Jean, one of the most important achievements you've made here is that you've been all able to provide training to dozens of nurses in sub-Saharan Africa and also in Asia, while also equipping them for the first time with the right tools like mechanical valves and cardiac ultrasounds, correct? So I'll let you take it from there.
Sure. Well, Arianne, thanks, and this is a huge honor, and thanks to the World Heart Federation and everyone for recognizing this work. I mean, I think Anna and I are part of a community of cardiologists, many of whom are here. We're just meeting earlier today about this work, and what we've been seeing, with our own eyes and facing is just this terrible tragedy of children, young adults dying every day. Rheumatic heart disease, congenital heart disease, peripartum cardiomyopathy, other cardiomyopathies, malignant hypertension, and we can call it that. And they're dying because they're poor and they lack access to treatment. And they're falling between the cracks of any global social movement, right? There's no space for them in global health, really. They've been made invisible by anything. And I think that we have finally hit upon a solution, an integrated solution that's gaining traction as a global movement to really reach these patients, get them to care, save their lives. And we're doing it by forming an amazing coalition with others who care about similarly severe, life-threatening diseases of children and young adults like type 1 diabetes and sickle cell disease. And we're leading with equity. And that solution is called Pen Plus, and you'll hear more about that.
Yes, I really do want to hear more about that. Anna, can you explain us what Pen Plus is?
Thank you, and thank you also. Like Jean said, it's a big honor for us. When we started and we met and started discussing what we could do with impact, we both shared this vision that there was something missing on our policy for non-communicable diseases and for cardiovascular disease. And this was from the experience of working in our own countries, myself and other colleagues that are here in the room, and Jean from working in Rwanda. And we have children and young adults that have severe cardiovascular disease that did not appear and do not appear in any agenda. So we decided both to explore more, and the Lancet Commission that we both shared on reframing the NCD agenda was really directed to those suffering, to those belonging to the poorest billion. And although most of them, we at the end of the commission had data and evidence showing that more than 80% were from sub-Saharan Africa. We did not have in sub-Saharan Africa any sort of movement in South Asia also, and pockets even in high-income countries. There are pockets of societies that have these people. We did not have anything to offer. And the point is, we both strongly believe in prevention, but we dealt day to day with people who are severely ill, for whom we did not have any solution. So our commission on reframing the agenda was really to be able to provide hope and to provide a solution for these patients. And what we do with Pen Plus is to have an integrated model of care delivery that can be used in rural settings where most of these people come from, that is flexible enough to allow countries to adapt it to care for severe and complex conditions. And our belief is that by addressing these severe and complex conditions, which we had to select because we need to prioritize, we will be able to give to the health systems in these locations where we are implementing the program the capacity to grow from there. Because by integrating care and by thriving for quality and also to strengthen the health system, we think that we will create the pillars to be able to start a stronger and larger response to incorporate all non-communicable diseases. So the diseases that Jean alluded to affect people who are either affected genetically, type 1 diabetes, so no prevention there, but also incorporate conditions, that are treatable and preventable. So those are young people who should not die. And the fact that they are sick very early in their lives also has impact in their own development, but in the development of the communities they come from. Because we all know, and we heard on last panel, catastrophic spending in poor people that have chronic diseases is really a problem. And access is a problem, but access is also defined by you not being able to approach or reach an hospital, but mostly to guarantee continuum of care for your condition.
All right. Now, Jean, back to you. You work in Boston. Anna works in Mozambique. So you work for the Center for Integration Science. How do they connect? How did they?
Yeah, absolutely. So I'll just to back up. quickly on, fill in a few things on Pen Plus, and I'll come back around to that. So Pen Plus, as Anna was describing, it initially started in Rwanda with training nurses in 3 rural district hospitals. And very quickly, within about 10 years, this was scaled nationally. There are now about 50 clinics, 100 nurses, more than 20,000 patients in Rwanda that are receiving high-quality care, getting access to cardiac surgery, getting followed for that surgery. And over the following 10 years, there have been an additional growth of this Pen Plus movement, first in Malawi that now has this in about 8 facilities. And then there are 12 additional countries that are initiating Pen Plus programs, building training centers, and policies working. And really exciting thing that happened in August of this last year is that the World Health Organization's African region, all 47 ministers of health of that region approved a regional strategy to scale this to a high level by 2030, and so that all the district hospitals in Africa would have access to this kind of care. More than that, a Pen Plus partnership launched in late last year in September at UNICEF House with the support of UNICEF, Helmsley Charitable Trust, Juvenile Diabetes Research Foundation, the Global Sickle Cell Coalition, American Society of Hematology, basically all the major organizations focused on those three diseases, working together towards this common vision of reaching the poorest people in the world with these severe conditions. And you're asking, how do we work together as a partnership? How do we work together as a Pen Plus partnership? Well, really, this grew directly out of the Lancet Commission that Anna was talking about. And that link is extremely important because from the beginning, the focus was on populations living in extreme poverty and reaching them first. And immediately when we published that report in 2020, we launched a global network called the NCDI Poverty Network that built on 16 national commissions that happened simultaneously with the Global Lancet Commission. Now that network includes 22 countries, and Anna and I serve as the heads of the co-secretariat for that network between the Universidade Eduardo Mondlane in Mozambique, and then the Center for Integration Science and Harvard Medical School in Boston. And I can tell you more about the center after maybe you had a chance to talk to Anna more.
Yes, yes. I do have to move on quickly with Al, and then we can come back, we can circle back. Al, of course, you are also one of the recipients of the awards. You come from Mended Hearts, and we take a look at how this organization is going the extra mile as well, at helping patients cope and understand heart disease. Can you share maybe the most important challenge or the major challenge and best practices you've come across when helping these types of patients?
Yes, thank you. And let me say, it is an honor to be here, especially with these 4 health colleagues. Thank you to the World Heart Federation for this honor. Stepping back just a bit, Mended Hearts is the world's largest peer-to-peer support network for heart patients, their caregivers, their families, and not only the heart patients with just heart disease, but heart patients with other comorbidities such as stroke, cancers, diabetes, or anything like that. We have 3 programs, Mended Little Hearts, Young Mended Hearts, and Mended Hearts, which provide support, education, and advocacy from the prenatal diagnosis all the way through the lifespan for all patients, all ages. Challenges that we had essentially 2 types, before COVID and during COVID and after COVID. And especially during COVID, everything stopped. We go visit patients, we talk to patients in person, and that absolutely stopped. So our staff, and several are out here in the audience, designed a program and helped the patients learn how to ask for support, no matter where they were. We donated iPads. iPads are donated to us. We donated them to the hospitals, and that way the patient could connect to another heart patient. And that challenge was really just getting everyone to understand that the norm had changed. Our current challenges are twofold. We talk a lot about prevention. Our support is post-event, but we really need to try to understand how we can try to help prevent cardiac disease. The other challenge we have is what has been mentioned several times, is to reach the patients in poorer areas, in poverty areas with little access or no access where there's no health equity and there's a big disparity in health care. And those are our two. From our best practices, our organization started 72 years ago. So we've learned how to support patients and educate patients through now multiple methods, from both virtual and in person. We do this with members living in the United States and 19 foreign countries, primarily in Europe. And we know how to give the patients a voice through our advocacy efforts, not only in the US, but anywhere in the world. And saying that, we understand patient engagement, and we understand how to get patients involved in their own health decisions. And that's what we really try to do. And it's, I think, a big achievement for us.
So Mended Hearts is, you were telling me before, it's the largest patient support organization in the world.
Yes.
What drove you to become a part of Mended Hearts?
I'm a heart patient. I actually had a heart event 6 years ago, and a Mended Hearts volunteer came and visited me and essentially told me how my life was going to change and that I'm going to have a new normal. And I did, because 6 weeks later I had a stroke, and another Mended Hearts volunteer talked to me, and it really helped me get through, and it helped my partner get through as a caregiver. And that's what inspired me. And from there, I have just volunteered and kept going.
And traveled around the world, right?
Almost every week.
Yes, you're a complete volunteer. You don't get any salary, nothing. And you travel every week to spread the word and to support patients around the world.
Yes, I'm very fortunate to do that. And I have an outstanding staff that live the mission of inspiring patients, giving hope to patients through advocacy and education and support. And they live that mission every day. Makes my life easy.
So what are the next steps for Mended Hearts?
Well, in 2 months, we are going to license a new association, an NGO or nonprofit, as some may know it, here in Geneva, to take over the operations in Europe, Africa, and the Mideast. We're expanding our services in the US, Latin America, and Southern America, South America. And we're looking at Asia through the European office. We have a very intense 5-year plan based by quarter, and we are working that plan. And our goal is to really be the preeminent organization that a patient can come to for absolutely free assistance, no matter where they are.
Great, congratulations.
Thank you.
Now, Anna, I just want to circle back to you really quickly. This question was meant for Jean, but I wanted to ask it to you as well. What makes you hopeful for the future despite all the challenges of your work?
A lot of things, and PEN Plus is one of them. I think that PEN Plus is the missing link in health systems from low-middle income countries between the primary health care and the tertiary hospitals. Mm-hmm. Tertiary hospitals are usually located in urban areas, few urban areas, and that's where the specialized care can be found. Unfortunately, there is this gap between the prevention and the first type of care in primary care and those tertiary hospitals. And PEN Plus being implemented in district hospitals makes this link. It completes the health system, but at the same time gives care that integrates whatever the patients want, and we are trying to make it patient-centered care. So we have task shifting, because you have heard about our challenges in terms of specialists, in terms of people reaching out to those communities. In a way, we are trying to get nurses, mid-level professionals, and I should say that Mozambique, for instance, is very, very ahead with using non-physicians and non-doctors to take care of people, because logically we don't have specialists. So we have all sorts of mid-level specialists that we are trying to bring together build multidisciplinary teams at that level, and transfer competences of specialists to these health providers so that we can build teams that are capable of assisting these patients close to their houses. On the other hand, PEN Plus has this primary care type of action of providing social support to patients, of providing equipment when needed, and solutions so that they can slowly be educated and be able to do some sort of self-management. Because as you know, and for that digital medicine is also helping, those patients are very far even from these rural hospitals. So for some contact in between consultations.
So in 10 seconds, what makes you, I'm sorry to interrupt you, in 10 seconds to summarize what you're saying, what is it that gives you the most hope?
I remember the question. So what gives me hope is that we are dealing with patients that are children, young adults, that are dying because they have diseases that cannot be treated adequately where they were born. Those diseases are treatable, and we need to see these patients as humans who have the right to grow well, healthy, who have the right to dream, and who have the right to fulfill their potential to be able to contribute to the communities they come from. This fact that you have a chronic disease in these countries increases your poverty and leaves you behind.
Thank you so much for all the effort you've made. Gabriela, last question, and for all of you as well. In under 15 seconds, let's see, what would be the main advice that you would give to everybody here to support patients with CVD?
So in the context of cardiac rehab, which is my area of expertise, really listen to your patients, understand their needs, their preferences, so that then when you address those needs, it's easier for them to attend the programs and really to benefit from the programs, from the treatment.
Right. Al?
To you out there, and many of you are doctors, cardiologists, or healthcare professionals, get your patients to seek out a patient organization that provides education and support and advocacy, because no one, patients or caregivers of the family, should go through heart disease or the other comorbidities by themselves.
Thank you. So important that what you just said right now.
Building on the voices, give voices to the patients. One of the biggest, the 4 strategies of the NCDI Poverty Network is giving voice to patients. We need partners, and patients are our partners in this struggle.
Yeah, and just to finish, I mean, I agree. Listen to patients, and the patients that we're listening to are telling us that they're dying, and that they need care now, and that's really the most critical thing. And I'll just say that what makes me hopeful that we're going to be able to do that. We were just in Mozambique with the amazing advisory group for this network and this project. We had Mark Schoenberg from AHA, Jojo Ferrer, leadership from the Type 1 world, and we saw patients who were getting fresh diagnosis with rheumatic heart disease in a rural hospital that would have never gotten diagnosed, and I was telling you, was just getting cardiac surgery. There was another patient, Type 1 diabetes, that had never had a glucometer. And this whole group, many of whom already had Type 1 diabetes themselves, descended on this patient like they were family, and they said it felt like they were their own daughter. And not only that connection that we had across a huge ocean, but also the connection between the diseases makes me feel hopeful that there's a possibility of a family, a kind of country of illness that transcends these very narrow national borders that we have that seem to be limiting our thinking about financing and a future for these people. So I think that there's a new kind of citizenship that's coming.
So many people you're helping, you're going definitely above and beyond. We all know that doctors are helping people and saving lives, but you here are definitely going the extra mile. You're moving the needle definitely in the right direction. So congratulations, keep at it. The world needs more people like you.